So if you're brave and you want to put your answer in the chat, that would be awesome. Guys, we're all learning. Yay, B, you guys are good. This was an easy one too, though. Yes, B is the right question. And so here's your little trick. When we're going through these, I want you to ask yourself 3 questions. First, is it an ABC, right? Is it airway, breathing, or circulation? And then second, how severe, or what's the most severe complication that could happen from this? So in this case, you're looking at respiratory distress and you're saying, what's the worst thing that could happen? First of all, you know that it's an airway problem. So right there, you've got a point. Then this severity of what could happen, meaning that person could stop breathing, right? That's very, very severe. And then the third thing you want to look at is how immediate is it? So is it an ABC? How severe is it? How immediate is it? How soon is it going to be that person is going to go into, for example, respiratory arrest, right? Or cardiac arrest, how soon? So those are your 3, kind of scribble those down because you're going to want to go through those for every single question that we go on. ABCs, how severe, how immediate, and then make your answer based on those kind of the answers to those questions. And then the other thing is I was telling, I think it was Darla the other day. So when we have a question like this, and there are a few on the exams, right? There are always a few on your exams. You have to do ABCs first, always ABCs. And then if there is no like ABC thing, like if this question didn't have a very, very obvious answer, right? The second thing you're going to look at is, you guys should write this down. So ABCs, then safety, then assess, then call the provider. Okay, so in most scenarios, you're actually going to get caught up before you end up calling the provider, because it'll be an ABC and you have to throw on oxygen, or there'll be a safety issue, or there will be an assessment that you have to do first. For example, now this patient is in respiratory distress. When you have someone in respiratory distress, then they are at a very high risk of an immediate problem, right? So you have to act. That's an ABC. Let's see if there's any other ones that are, let's see, there we go. Okay, let's try this one and see how we're doing. I started off easy for you guys. If you have a guess, go ahead and put it in the box. I love how brave you guys are being. Darla says D. Okay. Does anybody else have a guess they want to put in the box? So this one I put in because we're getting caught up in this best. We had a couple of these, I think, in one of our sessions. It was getting really confusing. So they're asking you the best method of preventing the spread of microorganisms. What is the best method? Not what you should do, not the first thing you should do. What's the best thing? And in this case, your best is absolutely going to be D. It's always going to be hand hygiene, guys. Anytime you have a question like this, it's always going to be hand hygiene. That's always the number one thing that you can do. C is good as well, right? You want to wear isolation equipment when you're working with the infected client and take them off before working with the diabetic patient. Absolutely, you want to do that. It's just that it's not the best method. The best method is the hand hygiene. Hopefully that makes sense. Anybody have any questions about that before I flip to the next one? Not. Okay, I'm gonna flip. Let's do that. Let's do this one. Everyone's going C with this one. Does everybody? Okay. So this is, whoops. Having issues today. So does everybody understand why C is the right answer here? If we ask ourselves, what's the most severe? What's the awesome? Okay, you guys are good to go. Let's do the next one. What? What do you, I have it on full screen, Pollyanna. You guys. Thank you for being honest. Pollyanna saying you guys can see the answers. I actually do have it full screen. Shoot. It's the same thing I did the other day. Nicole, I didn't even notice. Could you see them the other day when we were doing this? You little punks, nobody was telling me. Oh, can you see the whole presenter mode? That's probably why. Okay, give me a sec. Let's stop this share. Let's do this. Haha, this will get you. All right, now. Thank you for doing that. I don't know what I'm doing clearly. There we go. Okay. 45 seconds. Be brave and put your answer in when you want to make a guess, okay? I haven't even read it yet, Darla. That's okay. Okay. Everyone good? Can I highlight the Tanvir says D. So the answer here is D. And the reason for that is petechiae or petechiae is a sign of bleeding, right? You remember petechiae are those little like spots, blue spots under the skin that kind of make, I don't know how to describe them, but they are actually a sign of bleeding underneath the dermal layer, right? And so if we have liver failure, we don't have our PTT, right? We don't have our clotting factors as being made as well as they should be. So we're at risk for bleeding out. Cellulitis that is itchy. So a few of you put B, which is a good guess. Itchy cellulitis actually means that it's starting to heal. A lot of patients, when it starts to heal there, yeah, that's okay. It's something we're learning as we're going too, right? Some of the content you might not know. Who would you guys go to next after the liver failure guy? So yeah, it would be A in this case. I know you're thinking, Tanvir, that the ovarian cyst has.
Yeah, I thought it's torsion ovarian cyst kind of thing because of why the patient will come in emergency with ovarian cyst. Torsion ovarian cyst was one of the thing. It might be chronic berry. That's okay. Yeah, A is also could be there. My next guess is A also.
So personally, I work in Emerge, and I will tell you right now, people come to Emerge for the dumbest things. So, don't just assume because the patient has come to the emergency room that it's going to be something serious. Ovarian cysts can last as cysts for a very, very long time. And an ovarian cyst that bursts is not a big deal. It is, but it's not, right? We want to remove it surgically if we can, or get in there. But a burst ovarian cyst is going to hurt. But it's not likely going to affect the ABCs of that patient. Whereas, a pain out of 8 out of 10 is pretty serious. And you guys are right that we want to go and deal with that. Person's the most uncomfortable at that point. Okay, let's try the next one. Yeah, throw your guesses in, guys. This is a good one. Okay, so for those of you, so here, let's put the right answer up. It is C. So if you do the little strategy that I kind of said, right? What are the things in this that are going to be ABCs, right? So that knocks out B right there. It doesn't have anything really to do with ABCs at this point. A child with fever who received acetaminophen 10 minutes ago needs a temperature recheck. Is not necessarily at risk for a seizure. We've given them Tylenol, so we're not worried about that patient. Now, if they hadn't been given the Tylenol, would it be a different story? We would maybe be at risk depending on how high the fever is, because a seizure will affect your ABCs, right? So that would change the question. And then our D, I'm surprised nobody picked D. So ischemic stroke treated with TPA needs a neuro check in 30 minutes. So this guy is on TPA, which I mean, we need to be checking this guy constantly when they're on TPA. The reason, if you look at C and D, you've got chest pain, orders for an ECG, blood work, and vital signs. Nobody has seen this guy yet, right? He just has orders for an ECG, blood work, and vital signs. So everybody else has been D, even though D is at risk of whatever, of bleeding, for example, which would put your circulation at risk. Not having been seen yet puts C at a higher risk of something severe happening more quickly, if that makes sense. People usually get tricked up on this one. I'm super impressed. Okay, let's go to the next one. Some of these are super easy. So what are we worried about here, guys? Basti says B. What do you guys think? B question mark, hey? So, yeah. So this is the only ABC on here, right? The rest of them are not an ABC. A fever could a fever of 39 or 41 or something, sure, but a fever in general is not an ABC, right, on its own. An open leg fracture, again, not an ABC. We do want to hit that probably second, because we have something that's open to air, right, and we don't want to let all the bacteria get in there and whatever. We want to close that up as fast as we can. So absolutely C would be important. And then a cough and congestion. Again, this patient doesn't have any signs of anything else kind of going on. They have a cough. So if we had a cough and difficulty breathing, okay, we'd be torn between that and hemophilia. But this person, which by the way, I've never actually seen anyone with hemophilia. I don't know why they talk about it so much in school. This person is at the highest risk he's at risk of bleeding out, right? So it's an ABC. Does everybody see why or get that? That was easy. Okay, good. Okay, let's do the next one. Oh, I some of these I did them in order so that you could see what order I would go in. Let's do this one. So Darla thinks C. What do you guys think? So you have to think it through, right? So if somebody has a small bowel obstruction that could burst at any time, we don't want, it's okay, guys. Some of these are just, I don't know. So pain control is always important. And I think it's really good that you guys are thinking that way. And I think it's really good that they're teaching you that in school, because it is important. It's that, that sixth vital sign and whatever. We need to pay attention. And when people are in pain, we need to go there. But again, we have to do our ABCs and kind of think of like, we have this patient. What's the worst thing that could happen at this point? You would insert one exactly because they're in pain. You would probably, to be honest, you would do both at the same time in real life. And I know that's what's frustrating, but what they're asking you is what's the priority, not necessarily what you would do next. What is the priority, right? These are where these questions get a little bit tricky. So in the next thing the nurse should do, you're probably right, Darla, we would probably give something for their pain and do the NG tube at the same time, except a patient with a small bowel obstruction is likely on NPO status, right? We're not going to give them any food, nothing by mouth. They're probably going to have to have surgery to have that obstruction removed. So they're going to be NPO. But really, all of that doesn't even matter, because the question is asking what's the priority? What is the priority? What's the most important thing out of these four things? Not asking what you would do next. What's the priority? And so the priority is going to be in placing that NG tube, because it's going to start to pull some of that fecal matter out, so that it lowers their risk for bursting, for a rupture, right? And then when you end up with peritonitis, have you guys not gone through like bowel obstructions and stuff yet? Oh, for Pete's sake. Well, hey guys, we learned something new. Small bowel obstructions can burst and can rupture and cause peritonitis. They are extremely, extremely dangerous. First thing, our first priority is to get to relieve the pressure. So our first priority is to get that, get what we can out. They are obstructed, so they're not able to move the stool, right? So we have to pull it out through their mouth or their nose. And again, though, even looking at this question, sorry, Alyssa's saying, so would you prioritize your as ordered answers for the other questions too? Sorry, I'm not really sure what you're asking, Alyssa. Could you clarify that? We look back here, you mean?
Sorry, so it says like as ordered, right? So would we just prioritize if there was other questions that said, oh, do this as ordered? Should we prioritize those first?
No, not always, because you could also have even make sure that the client's pain is controlled is going to be through an order as well, right? Everything you're doing technically right now is under an order. You guys can't do anything except, I think, give 2 liters of nasal prong oxygen. That's it. Nothing else. Everything has to have an order. So all of these things are assumed. The orders are assumed. You can't even do an enema without an order. You can't do anything without an order. You can't even get them ready for surgery without an order for surgery, right? So we're assuming the orders are here for these things. And most of the time, so when the people who write these questions kind of have been in it for a long time, and they just assume that you guys, I think that you fill in some of the blanks, but I find the questions are pretty straightforward if you just think ABCs and safety, right? This one was, we went past the ABCs. We didn't have any issue here that was an ABC, but we do have a safety issue because that NG, that obstruction is going to rupture. So we need to get that NG tube in there immediately, and then we would control their pain and get them ready for surgery. I think I probably put all of those up here. Yeah. It's not, so sometimes you would put them on suction. You guys don't need to know this for your exams. So you were thinking you would place an NG tube to feed them? Gotcha. Okay, that would be confusing. Gotcha. So no, we're putting the NG tube in to remove the stool that's above that obstruction. Yeah. So, and I think that's because you guys did in your labs this semester, you talked about enteral feeding and stuff. So your head went straight to that and you're on a stroke unit. Okay, that makes sense. You got to think You got to try to put yourself in the question, especially for those of you who are already working as RPNs. You got to take some of your experience. It's hard when to know when to use your experience and when to let it go, right? In this case, you're not on a stroke unit. We don't know where you are. You have to kind of put yourself in the question. And the other thing is, we don't ever want to give an enema, right? We don't want the patient going to the bathroom after they've already been diagnosed with an obstruction. We need to rest their bowel. I'm going to move on to the next one because you guys don't need to know that stuff for your exam. It's just the prioritization we're playing with here. Do we understand all the terms on this slide? Interesting. What's making you think A? Because a lot of people are leaning there. Oh, D, B. Okay, so let's go through it. So, and this has a lot to do with what we learned in patho about shock and about some of the things that can cause shock. Anytime you have somebody with difficulty breathing and angioedema, you have to think anaphylaxis. You have to immediately think that they have the risk of going into shock. So, room air. So let's look at C and D. Those ones are, C is fine, right? D 95, that's fine. I'm not worried about that person being the most concerning. Our person with COPD history, they're on 2 liters, they're satting at 89. Don't forget that we want our COPD patients satting between 88 and 92. We don't want them satting, right? Remember, because of the I'm not going to go into this whole thing. Go back and look at the COPD video, but we want COPD patients satting between 88 and 92. That's their safe zone, because we don't want them to retain any more CO2, right? So in this case, the only person who is an ABC would be the person with angioedema, right? This person is at risk of anaphylactic shock. Does everybody understand that? Yep. Okay. That makes sense. Good. Let's try this one. Oh, wait. I guess. Sorry, Alyssa's asking, would D be the second most concerning? Sure, but not really. The other 3 are all fine. They're all within normal range. 95% on room air. It's negligible, the difference between 95 and 100. They're getting enough oxygen. They're fine. So nobody else is concerning at all in that. No problem. Okay, I threw this in here just to make sure you guys were on the right track here. So everybody gets A. We're doing airway, right? What would we do second? Tanvir thinks B. Anyone else? No guesses? Okay, so it's actually D, right? We need to maintain that map. You remember back to your head, your head injury unit. We need to keep that CPP in that healthy range. We need to keep the brain perfusing, so we have to keep our mean arterial pressure above 65. Monitoring for hives, sure, but it's not necessarily important, right? It's just going to confirm what we already know, which is what the patient's having an anaphylactic reaction. It's not necessarily a priority. Again, make sure you're looking at these words. These are that's what's giving you, pointing the direction, and PRBCs are useless in this case. So let's go to the next one. So just do the steps that we talked about: ABC, safety, assess, call the provider. You got it. So you see how it almost feels too easy when you start to think like, oh, sorry, it was D and then C. Sorry, I didn't see D there. You guys are on the right track, right? You're on the right track. We want to do an assessment first. And this question I find is a little bit, I wouldn't say it's unfair, but you're going to do vitals as part of your neurological exam. It's part of your neuro exam. So that's why they're saying D. Quite frankly, your C is arguably the right answer as well. The point is we want you guys thinking ABC, safety, and then assessment. It's okay because most of you, wouldn't necessarily think like, oh, well, we're just going to do vitals as a part of the neurological exam anyway. So you were on the right track. And I promise there aren't anything like that on your exams that are like, you don't have the full information. You just didn't have that there. But you guys understand the important thing that I want you to take away from this slide, right? Which is that we want to do an assessment first. Okay, the patient's not at risk for any ABCs. They're not at risk for any safety issues really at this point. So if something has changed, they've had a major LOC change, then we want to do an assessment first. And whether that's C or D, in this case, again, yeah, I would probably say D with C on the side. It's a stupid question. It was harder to find these questions than I thought it would be, guys. So sorry. Let's try this one. That's a good one. So ABCs, safety, assess, call the provider. Anyone else guess? People are saying C. Does everybody think it's C? Elizabeth thinks it is B. Alyssa agrees. So what are you guys thinking in terms of pelvic pain after gymnastics? No, Darla, you're right. The answer is A. ABCs. So which one of these are any of these patients at risk for an airway issue? No. Are any of these patients at risk for a breathing issue? No. Are any of these patients at risk for a circulatory issue? Yes. You have a patient who's been bleeding on and off for a month. Depending on how much blood they've lost, that's right. You've got it, Darla. Depending on how much blood they've lost, we need to see that patient now. They could be going into hypovolemic shock in the next minute for all we know. They've been bleeding for a month, right? And I think that these questions, I think across the board, nursing questions should give us more information than they do, but they don't. They're often like this. And it's very frustrating because you're thinking, well, what if it was like a teaspoon? I don't know how much the person's bleeding. And in that case, you have to kind of try to think, what's the worst thing that this could mean? What's the worst thing that this could mean? And go from there. Usually if you ask yourself that question, it will help you. I think there was one back here. Oh, whatever. Especially when we're doing this, when we're looking at 4 patients who have 4 different things going on, and you have to pick which one you're going to see first. You only have, some of these, you only have 2 words of a clue to know what's going on with this patient. So you have to ask yourself, what's the worst possible thing? What's the risk? Who's at the risk for the most severe, most immediate thing, right? So you're doing your ABCs, but you got to play out. You have to play out each one of these things. The pelvic pain that started after gymnastics practice. So when they put something in there like that started after gymnastics practice, I mean, pelvic pain, what's the worst that it could be? The very worst that, reasonably after gymnastics practice, Tanvir, what's the worst thing that a pelvic pain could be?
Honestly speaking, this scenario, like it was very less information. I was thinking since because vaginal. Okay, let's start with the vaginal beginning. Because since they are on triage emergency, so why the patient with vaginal on and off bleeding for 1 month they come all on a sudden without. That's why I ignored that. But pelvic pain, I thought because this is pretty much gynae case, so look like maybe pelvic pain. Maybe the patient was kind of having a little like first trimester pregnancy or like unnoticed pregnancy or kind of thing. So ovarian cyst also, there could be the ruptured ovarian cyst, as torsion ovarian cyst, other things maybe.
Okay.
Abscess, this is obviously no link, and UTI for sure no. So that was my rationale.
Okay, so when you see pelvic pain, guys, they were talking about pelvic, lower pelvic pain. When you have something like an ectopic pregnancy, they're going to say abdominal pain. They're going to say severe abdominal pain. They're definitely not going to talk about gymnastics practice, right? They're going to lead you to what's the worst possible thing this could be, an ectopic pregnancy. Pelvic pain, the worst thing it could be is, pelvic disease. Like it's there's nothing really severe or immediate about that pelvic pain. If Tanvir's right that if the patient had extreme abdominal pain, especially unilateral, so one side abdominal pain, sure, you would definitely think ectopic pregnancy, but you're adding a little bit too much to the story, right? It's a balance between going with what they give you, but also trying to think what's the worst thing that this could mean. Your patient comes in, they say, I have pelvic pain. What's the worst thing it could be? Leg access. What's the worst thing that could happen? What's the worst thing that could happen? If it's an ABC, that's probably your guy. But the other thing I want to encourage you guys to do is when you answer a question like this on your test, you pick, for example, you pick B. A lot of you thought B. Okay. You pick B. I want you to go through the rest of them. Go through A, C, and D, and tell yourself in your head why those are the wrong answers. I can't tell you how many times I've caught myself and changed an answer properly because I've done that. If you had thought pelvic pain and then gone through leg abscess, gone through burning onion, whatever, but then you hit A and you thought, what's the worst that could be? And you actually remembered, well, they could be bleeding a lot for a month. She's coming into emerge now, meaning maybe she's having symptoms. So, there's something, the potential for a severe side effect is much higher in A than it is in B. Okay, that's enough. I'm trying to give you guys lessons as we go through. I don't know. Here, let's try the next question. Camille says B. Darla says A, B, B. So you've got, in this case, we've got kind of a tie here between A and B. So I want you to stop and ask yourself, between those two, what's the worst thing that could happen? Chest pain after a motor vehicle accident? Or what is likely? What's the likely scenario there? If you have chest pain after, it could be a crush injury. Yeah, it could be a crush injury. What's more likely, that or what's chest pain and diaphoresis? What does that mean? Anytime you have chest pain plus a symptom, you have to assume that person is having an MI, and that person most likely is having an MI. Chest pain and diaphoresis is 100%. 100%. We have to check that first. Have to. We know that chest pain plus diaphoresis means MI. Chest pain after a motor vehicle accident could mean I don't know, something really horrible, like there's a tamponade going on, but most likely with a motor vehicle accident, they've hurt themselves, they've bruised their chest, right? That's kind of the likely scenario. It's the same if you go back here to this gymnastics practice. the likely scenario there is that she bruised her pelvis. She was probably doing the, parallel bars or uneven bars, and hurt herself, right? When they give you something like this after gymnastics practice, it gets hard, I know, because they try to hide stuff in there and they're trying to be tricky. But when you come across a question like this, where you see these two things that could be something really, really bad. Chest pain and diaphoresis is bad. It's an MI. That's an MI, right? You got to go with that first before this chance of, let's say, a tamponade or a crush injury with the motor vehicle accident. Does that make sense? So I've taken you past now to where we're thinking, what's the worst possible situation? But we're thinking, what's the worst possible and what's the most likely, and also when you have two worst possibles, what do? You go with the most likely. Okay, so you have two here where there could be two really terrible things going on, so you stop and ask yourself what's most likely, and it's most likely, most obvious, that the person with chest pain and diaphoresis is having a heart attack. Hopefully that makes sense. Let's go on. Okay, so ABCs, safety. Oh, thank God, this was an easy one. And I was just really hoping you guys were all going to get it, and you did. So why? What could be going on with altered mental status and a fever? We actually kind of talked about this earlier, about the risk of seizing. Yeah, right? Because seizing is going to affect our ABCs. And so seizing, anytime we're anywhere near a seizure, we need to pop that up to the top of the list. Plus, if you look at all these other things, I guess B you could look at as a circulation issue. So let's say you look at B as a circulation and C as whatever, a seizure risk. Which one is more immediate, right? C is much more immediate. Even if that finger swelling meant the finger was going to fall off, it's not going to do that for a couple of days. So I think we have some time. Let's deal with this altered mental status. Guys, anytime you see altered mental status, that's a flag. Make sure that you're paying attention and reading what's around that and what's going on around it. Pretty much anytime you have altered mental status, though, something major is going on, right? I don't know why I did this, just so that you, 28-week pregnant with bilateral swelling, you guys know is normal, right? Unilateral leg swelling, we'd be worried about. But one leg, two legs, well, that's pretty normal edema. Let's try this one. So before you answer, before you guess, to do your ABCs, your safety, whatever, that whole thing. When you get to, you're torn between two of them, I want you to ask yourself the questions that I told you at the beginning. Which one is more severe? Which one is more immediate? Immediate and severe, that's what we're looking for. When you have two that you can't decide against. Oh, it's okay. You're funny. So do that again, go through. It is A, guys. It is A. Tanvir, read the question again. You're backwards. So guys, again, you're doing those ABCs, you're doing those steps. Don't forget that, right? ABCs. You've got two issues with circulation. You've got a guy with a DVT. That's
okay, circulation, right? A then. So if you tell circulation, then A, yeah.
Okay, sorry, let me finish, Tanvir. So if you've got two guys with circulatory issues, and so you have to look at both of those and then ask yourself which one is at risk for the most severe and most immediate consequences. When you ask yourself that, right away, it's going to be your person with the pulmonary embolism. They have to be treated first. That's an immediate threat, right? Then your DVT guy. Okay, so that's I'm trying to, I have a ton of these questions I can give you guys, and you can go and practice them at home, and that's fine. The point though is I'm trying to give you like a structured way of kind of thinking your way through the question. So asking yourself, are there any ABCs or safety issues? If there are, then asking yourself, what's the most severe and most immediate risk? That's how you answer these questions. Whew, sorry. Let's go to the next one. Kidney stone, we don't want, whatever. Oh, these are fun. Okay, give you a little bit of extra time on this one. Oh, I love you guys for getting that. I think you're starting to pick up, like, when you ask yourself those questions, these questions actually seem stupidly easy. Like they start to feel like, well, yeah, obviously. I mean, this guy's got an airway issue, obviously. And it's something that before you would have felt really struggled with. And now it just seems like second nature almost. We're talking about the most urgent. So you're going to ask yourself those questions again, which one's at the highest risk of being, the most severe consequence the soonest. Awesome, you guys. Super awesome. Let's try the next one. AAC. So this one's a little bit tougher. And I put this one on here for a reason. So you guys are all following my instruction, which is we want to assess, right? We want to assess, we want to know what's going on, but how do we assess? So we should assess in the same order, assess in the ABC order. So your first thing you're going to check and see is if the airway is open, right? Your ABC, airway, then breathing, right? Then circulation. So in this case, you would actually go A, airway, breathing, C, and circulation would be B. Do you see that? So beyond where, if you end up with a question where you've got a bunch of different ways of assessing somebody, go with your ABCs. Again, ABCs, we need to check the airway first. So hopefully that makes sense. Let's try this one. Anyone else have a guess? D. Most people are saying D. Some guess B. Good, Camille, D. Okay, so the answer is D, and that's because we have a change in level of consciousness and neurological function. Right there, you have 1, 2, 3, signs of. You've got 3 signs of a stroke. It's textbook stroke, right? I don't know who 19059 is. I'm just going to call you 59. She's got it. He's got it. I don't know. Give me a pronoun at least. So we would do that first. And actually, our second would be this guy. We're not, we're worried about the infection for sure. But again, it doesn't have the most severe and most immediate. Oh, Andrea. Oh, good. The most severe or most immediate kind of issues, right? The leg swelling with the 4+ pitting edema and a history of lung cancer is going to be an issue with breathing and circulation. So we need to get that person before we worry about somebody who's got obviously an infected wound that absolutely does need to be taken care of. Hopefully that makes sense. A is kind of a breathing thing, right? Blah blah. Okay, let's go with this one. So those of you who came to my reviews should be getting this without even like a thought. We've got a client with altered mental status and fruity breath. What is that? You shouldn't even have to go any further into the question to know what that is, right? We know this client has DKA. They're coming in with DKA. Darla's got it. What is the priority intervention? What do we do first with DKA? I swear I hammered this home so hard. Yes, Haley, thank you. Yes, Darla, you guys got it. The first thing we're going to do is we're going to give fluids. Then we're going to give insulin, right? Then we're going to treat the potassium imbalance, and then we're going to treat the acidosis, right? We go in that order. This is absolutely really, really important to understand about DKA treatment. Now, nobody yell at me. So yes, A was the answer, hypovolemia. I want to treat the fluids first. Nobody yell at me, but this question here has well, yeah, we know, Lauren. This one here has a different answer. So just read through it and see if you can pick out why and what the answer would be. This is so incredibly frustrating. You'll want to cry. Shouldn't have put this in here just to make you guys frustrated. So A and B is kind of and D. I guess I see what you're thinking. You're monitoring for hypervolemia because you're treating with, yeah. So you have a patient with altered mental status and fruity breath. Again, DKA. They come into the emergency department. What is the priority to monitor? So the difference between these two questions is this one's asking you what you're going to do first. What's your intervention? What are you going to do? This one's asking you, what are you going to watch? Like, what levels are you going to be? What's the most important blood work that's coming back that you're going to be watching? What's the most important level or number that you're going to be watching? And it's going to be B. You're going to be watching those glucose levels, right? Because we know that's the main thing that's happening here, right? The main thing that's happening is this patient has too much glucose in their system. It's causing this DKA. And so that's something we want. That's the most important thing we're kind of keeping an eye on. We're treating the fluids. It's so confusing, guys. And I feel your pain, but I wanted to show you how different, how the wording of a question can give it like a completely different answer. So because I want you guys to like really, really, really read the questions. What are they asking you for? Is it the priority intervention? Is it the first thing I'm going to do, or is it the priority? Is it the most important thing I'm going to do? Because those are two different things. Sometimes the first thing you're going to do is give a pain med, and sometimes the first thing is not necessarily the most important thing, right? Because you're going to give pain meds, but then you're going to drop an NG or something, and that's really the important intervention. Does that make sense, or am I confusing you guys more? I'm confusing you more, aren't I? Maybe you shouldn't have come today. Are you all crying out there? Guys? Yes, you're crying. Andrea's good. Alyssa's, yes, you're crying. Okay, I only put 20 of these together because I'm always crying. Me too. You're in nursing school. That's just the basic rule. We're all crying. Look, that was an extra tricky kind of thing that I wanted to show you. I promise you do not have any crazy questions like that on your exam, okay? But just wanting to kind of trigger in you guys the idea that you need to read the questions more carefully than you're reading them. Because that's where, you know, a priority and usually a priority is what you're doing first, guys. Usually like 95% of the time, your priority is the thing that you're doing first, but it's not always that way. So I'm just trying to like think you're definitely triggered. Don't worry about this question. When you guys get to your exam, you're going to fly through it. It's going to be so easy compared to this stuff. So easy. You know the information. I know you know the information. Those of you who've been coming every week, you know the information. Darla, when I said DKA, what's the first thing that we do? I bet you heard my voice in your head saying, fluids, right? Yeah. You guys know this stuff. You know this stuff. When you have a priority question like this, and you're going to get them a lot more in your lab exam than you probably are in your patho exam, what I wanted to show you today was to go through those things, what order you need to think. ABCs, safety, assess, call the physician. Then what's the most severe? What's the most immediate risk? If you ask yourselves those questions when you're going through, you're going to be like, oh, this is easy. Like they're all obvious. Okay, so that being said, I have a bunch more that I can post for you guys, or actually, I'm going to get 1,000 emails, but because I'm doing this, so I don't know if you guys like, my contract is up for like running our sessions. That's why I'm doing Zoom, because it's just something completely separate from that. So I want to give you this email address. Or you guys have my George Brown. All of you have my George Brown. Okay. Email me if you want the rest of the questions. I will put them, I think, in a Google Share maybe, and then everyone can just like download them and whatever. All right. Let me know how the exams go, okay, guys? Like, just shoot me an email and be like, hey, I kicked butt. Email me if you want more of these questions. I have 70 of them. These are the first 20 of 70. But if it's overwhelming you, you have what you need. I've told you how to answer those questions. You have what you need to answer those questions. You don't necessarily need to practice, but if you want to, it's totally fine. Okay. Thanks, guys. No problem.